Now in this section we will talk about different variants of Meniere's disease, and these variants will include the cochlear and vestibular hydrops. As the name show, hydro is with the water and fluid retention. So cochlear and vestibular hydrops, these are the two main structures of endolymphatic system. Then we will also talk about drop attacks. Drop attacks and what's the Lermois syndrome, and then what's the difference between Meniere's disease versus Meniere's syndrome. The cochlear hydrops, if you see here, this is the cochlea, the snail-shaped structure is the cochlea. This is the saccule, and then this is the ductus reunions. So as the name shows, ductus reunions is the duct that unite the cochlear duct and the cochlea and the saccule, and this is the ductus reunions. So ductus reunions. Cochlear hydrops is the cochlear symptoms and signs of Meniere's disease are associated with or are mainly due to cochlear hydrops. And there is no vertigo. Cochlear hydrops, no vertigo. The balance and vertigo is mainly associated with vestibular portion of the endolymphatic system. So in this, when the cochlea is involved, there is no vertigo present. Block at ductus reunion. So if there is a block at ductus reunion, the fluid won't go out of the cochlear duct and it causes distension of the cochlea and cochlear ducts leading to cochlear hydrops. So mainly in this there is obstruction to the ductus reunions. Increase endolymph pressure to the cochlea only. So the fluid will go back and cause distension of the cochlea. Then vestibular hydrops. Vestibular hydrops is mainly, you will see now there is vertigo as compared to cochlear hydrops where we have no vertigo. So this is the cochlea. This region is the vestibular region, and then we have semicircular canal. Vestibular region have saccule and utricle. So attacks of episodic vertigo with normal cochlear function. Recurrent vestibulopathy. So it keeps on coming, the abnormality, and this condition keeps on, there are recurrent episodes of vestibulopathy or abnormality of the vestibular system, vestibules. Drop attacks is also known as Tumarkin's otolithic crisis. Otoliths are the saccule and utricle present in the vestibule. So when there is Tumarkin's otolithic crisis, or there is pressure on the otolith, it can cause drop attack, and usually this drop attack is without loss of consciousness. Patient is conscious, they drop, they fall, and if they don't have any, if they don't hurt themselves and they have no injury, they can get up and then they start doing their own routine work they were performing. So this drop attack is without loss of consciousness, and the patient regain the activity quickly and fast. No vertigo or fluctuations in hearing loss. So in this, there is no vertigo or fluctuation in hearing loss with the drop attack. Lermois syndrome. There is progressive deterioration of hearing in this syndrome, and there is also attack of vertigo associated with Lermois syndrome. So slow progression of hearing loss, and finally ultimately leads to complete deafness. Attack of vertigo is also present. Meniere's disease versus Meniere syndrome. Meniere's disease is idiopathic condition. Meniere's disease is a condition, unknown cause, usually it's the Meniere's disease. But when Meniere syndrome is present, we have different factors that can lead to symptoms that can be like the Meniere's disease. There might be vertigo, tinnitus, hearing loss, fullness, all that is present. But there is a cause for all these present. So one is idiopathic, known cause. The other one is associated with causative factors, which are usually trauma or injury. Then we have different viral infections, syphilis, Cogan syndrome, autosclerosis, or autoimmune disorders that can lead to Meniere syndrome. So syndrome is a condition which is associated with some other factors, but in disease there are no known factors or no causative factors present. So as compared to Meniere syndrome, Meniere's disease is because we don't know the cause of the condition, treatment is would be harder, because if we know the cause, if this is viral infection or trauma, and then the underlying cause is treated, then the condition can get better or it can improve. So that was all about some other associated conditions with the Meniere's disease, in which we talk about cochlear and vestibular white drops versus the drop attack, and also we talk about the different syndromes, difference between the Meniere's disease and Meniere syndrome. Thank you for watching sqadia.com.